Hey ladies and gents, Dr. Fontaine, starting a series on how to talk to your doctor. Everybody today is kind of under the gun in terms of doctor-patient interaction. Doctors are being faced to see more and more patients, and that means less face time with patients. So how do you talk to your doctor? What questions do you ask? What are the topics you talk about? How do you get the most out of your interaction? So I want to talk a little bit, this first video, and I titled it Triage, Trends, and One-Offs. And basically what we're talking about is prioritizing when you go in to see your physician. Have a plan of attack of what you need to talk about, because we are limited in terms of how much time. We're also limited in how many things we can address in any one visit. So keep in mind this applies to whether you're having an annual with your primary care physician, or you're having a follow-up with a doctor for, let's say, a musculoskeletal complaint. I'm a sports chiropractor, so that's what I do. So this entire topic is going to kind of be focused in the realm of physical medicine, whether you're a physical therapist, a chiropractor, a physical medicine and rehabilitation doctor, pain management, orthopedic, neurosurgery, etc. We all kind of fall under the same realm of physical medicine, meaning we're dealing with musculoskeletal complaints or neuromuscular skeletal complaints. So 1 in 3 visits to a primary care physician are for musculoskeletal complaint. Now, today, primary care doctors are being forced with the task of being a jack of all trades, master of none. When it comes to musculoskeletal medicine, they really are not specialists in this. And so, what do if you go to see your primary care doctor? Best thing to do is probably ask for a referral to a specialist, and I would start with a sports chiropractor, physical therapist. If you need to see an orthopedic, usually that's pretty evident if there's been trauma and we suspect some orthopedic injury that would require orthopedic surgery. But let's kind of get into what we're dealing with, the lay of the land. Number one challenge that we face today is misinformation. As patients, there's a lot of information being thrown at us, tons and scores of information online. And where do you start? How do you filter through what's fact, what's fiction, what are truths, what are trends? Very difficult to figure that out. That ends up also bleeding into the second thing, which is a lack of trust. A lot of times today, patients just don't trust their physician, maybe because they haven't seen their doctor in a while, or they may have been mismanaged and just they're not getting a lot of answers. I see a lot of patients in clinic, chronic problems that have been from this doctor to this doctor, seen a whole slurry of people without a whole lot of answers. So it's understandable, the frustration, and that often leads a lot of people looking at the question of, where do I go for help? Is this something I'm just going to have to live with? So let's break this down a little bit. Two of the biggest things that I think are a problem for us as patients and physicians is escalating costs of healthcare. More and more of that cost being put on you, the patient, and the carriers are restricting your access to care. Higher premiums, higher cost to care, and the insurance carriers are limiting your access to care. So those are two really big problems we run into today. A couple of statistics, I don't want to get too in the weeds on this, but according to the World Health Organization, the United States ranks in at number 37 when ranked against 191 of the major countries in the world in terms of our overall health ranking. According to the National Health Expenditures accounts, 17.7% of GDP is compromised of spending on healthcare in the United States. 17.7% of GDP on healthcare. And what are we getting for it? Well, we're ranking in at 37 out of 191. Not good. So let's get into kind of what's going on. What should your doctor provide? What should you expect? Well, your doctor should be providing education, number one, and that means their credentials, medical schooling, all of that. But they also should be educating you, the patient. That's based on taking a comprehensive medical history, doing a physical exam, and then taking the symptoms and the story that you present with and putting that into context, using their clinical experience to kind of take all of the symptoms that you're presenting with and to put those into context and come up with a proper course of action. The other thing they should be providing is a good referral network, and that is a referral network to specialists. So orthopedic surgeons, neurologists, neurosurgeons, pain management, sports chiropractors, physical therapists, acupuncture, massage, the list goes on. As a patient, what should we be telling our doctor when we go in? Well, let's talk a couple things. Most patients are getting into Dr. Google online, and doing some research. They're self-diagnosing, and they're also listening to friends and family talk about them. Oh, so-and-so had this injury, they had this for treatment, go get that done, and et cetera, et cetera. So I would caution people when talking to people who are not medical experts and getting medical advice. Now, it's great to talk with people and say, hey, I had this problem and I went and had this done and it really helped me out. It's food for thought, something to talk to your doctor about. But let's kind of get into what's going on here. When you go to see your doctor, the number one thing you want to do is triage what is going on. A lot of patients present with multiple complaints, especially in musculoskeletal medicine. They might present with back pain. They might have neck pain, hip, foot and ankle, shoulder. Keep in mind that if you chase two rabbits, you usually catch none. So you want to triage and prioritize what's going on. Pick the number one complaint that's been going on for a while. Most of the patients that I see in clinic present with chronic recurring problems. And so there's probably one or two problems that are your number one thing. You want to really take a look at that, and you want to really hone in on where and when does it hurt. The more specific you can be to your physician with that, the better off we're going to be in a starting position to go down the right path. We also want to look at what type of pain are you having. What does it feel like? Is it sharp, dull, burning? Different pains can mean different things. And so that brings me into what are the things we should be discussing at your visit? Well, number one, anatomy drives the bus. We start with a good mechanism of injury, and a lot of times there is none. The mechanism of injury is chronicity over time. That means the pain and the symptom came on gradually over time. I don't know what happened. Haven't done anything differently. 80 to 90% of the things we see in clinic in the physical medicine world tend to be of a chronic nature. And that includes pain management as well. So anatomy, starting off with where does it hurt? And then getting into biomechanics. Biomechanics, if there's a mechanism of injury, we're going to look at that. You know, a sprained ankle, a torn ACL. But if there's not a mechanism of injury, we need to look at biomechanics. And that means assessing how the body is actually moving. Your body, how your body chassis is moving. We're going to look at gait, how you walk, how you run. We may look at how you squat. We're going to do range of motion testing, muscle testing, these kind of things. So those two categories of things are going to give us an insight as to what's going on in the body, how it's moving in deviated patterns or compensations. You know, one of the things we'll look at a lot of times is someone's gait. We may see a limp, and a limp is nothing more than the brain's attempt to offload an injured or painful joint. So what we see in a limp is just your body's compensation getting around a problem. It doesn't indicate to us what the problem is. It's just more information. It's a window into your body's nervous system, because the human body is very adaptive, and it will compensate to work around limitations in movement, misalignments, muscle imbalance. And the result of that is loss of power, loss of function, and further on down the road we go until injuries tend to get progressively worse over time. So once we've looked at biomechanics and anatomy, we need to look at recovery and prevention. And the first thing we want to look at there is movement. Again, we're going back to movement. How are we moving? Where are the dysfunctions, and what are the things we need to do to correct for those? We need to address movement before we address strength and speed. Otherwise, we're just building strength on top of dysfunction. So after having all this addressed in an initial visit, we need a point of attack. We need a course of action. So let's talk about a couple things. Not all symptoms are created equal. According to the American College of Radiology guidelines, most cases that present with musculoskeletal care, excluding acute trauma or sports setting injury, in other words, these are injuries that came on gradually over time, we do not need to do imaging, X-ray, MRI, within 4 to 8 weeks of conservative care, unless there are red flags. Red flags are things like unexplained weight loss, other things in the history, severe limiting pain, things like that. But for the most part, we're usually green lighted to start a conservative course of care, 8 to 12 weeks of 2 to 3 times a week of treatment. Now that treatment needs to be integrative, systematic, progressive, comprehensive, and collaborative. Now what do I mean by that? Well, integrative, we need to be addressing 3 pillars. Manipulative therapeutics to the joints, Also, manipulative and mobilization techniques to the soft tissues and fascia. That's releasing tight, glued down areas. That can include dry needling to reduce trigger point activity in the muscles. And then we need to round that out by doing the proper corrective exercises. And that exercise prescription needs to be systematic, progressive, and comprehensive. It needs to scale. We need to be able to scale exercises back to a patient's level. Where are you today? And doing what you can with what you have. In the middle here are lifestyle education pieces. How well are you sleeping? Recovery, nutrition, stress, those kinds of things. So this is just a quick high level down and dirty on some things to think about when you're going in to see your physician. Have a plan of attack. If you have multiple injuries, prioritize. You're probably only going to get the first thing looked at. Make sure it's the number one priority. You know, if you're doing a home inspection and they come through with a laundry list of stuff, you really need to look at the priorities. If you got a roof leak, you need to fix that first. Problems on the exterior need to be taken care of. So keep in mind that not all symptoms are created equal, and looking at trends. What are those things that are recurring? You know, back pain that's recurring daily, aggravated by activity. My back gets aggravated after I deadlift, run, etc. Those are trends versus the one-off. I slept on my shoulder awkward a couple weeks ago and I had this sharp pain and it was gone in a day. Probably not a good thing to bring up to your doctor. It's a one-off. Unless it becomes a trending pattern, then you got to look at it and say, maybe I have to add this to the list. The bottom line is you want to try to make effective, expeditious communication with your doctor. And so realizing we're probably not going to be able to address multiple areas of complaint unless they're related. Foot bone is connected to the ankle bone, to the knee bone, etc., and that's very much in play. And a lot of times something going on in the lower extremity can be a cause for something going on further up the chain. So looking at the body globally is an important thing, and all good sports physicians should do this. But when we're talking about complaints and where we start, you want to prioritize that with the number one complaint. What's the biggest area of pain that you're having and the biggest limitation that you're having? That's where I would start. Hope this helps. We're going to be doing some more video breakouts on how to talk to your doctor and how to get the most out of your doctor-patient relationship. Remember, that's one of the most important factors in your overall outcome is how the relationship is with you and your physician and how well you communicate. Your doctor should be empowering you and educating you. That's their job, and hope this helps. Take care.